Good morning, ladies and gentlemen. With profound happiness that we welcome you to this 6th National Finance Conference. And I'm glad to see the room full, because I was very worried. There are so many meetings happening today, and also the fact that tomorrow is the joint review mission for Ministry of Health. I was not sure we would have full room. I'm very glad to see all of you. I'm a very bad civil society activist who doesn't even know how to do protocol, but I would like to recognize the government representatives, the members of parliament who are here. I've seen Honorable Sarah here. She has come in, and all of you, fellow civil society members, I'm glad to see you, and I hope that we shall have fruitful deliberations. We have discussed the background, but I also would like to highlight that this year we are very highly pitched on community health system strengthening. We also see that it's like a magic to now invest in CHUs, community health extension workers, and VHTs. And some of us are worried about what is going to happen to us, the peer educators, the passionate mentor mothers, the passionate malaria champions that have been working around, and how they're going to fit into the 2 VHTs per village or the CHUs per village. We need to get a little bit more understanding about it. But our biggest concern is what financing do we have for the community systems, for our peer structures, for our support groups, for our coordination mechanisms, and also how recognized are we in this entire health systems strengthening process. We have advocated for lots of funds. I know Global Fund reserves some money for community system strengthening. We have PEPFAR investing, the government putting in around PHC. But we would like to see a little bit more efficiencies in the budgets and the finances that are being released. And we put our eyes to our honorable members of parliament, because it is to them that we see money is being appropriated, and also for oversight, so that when we invest this money, given the dwindling and shrinking resource base, we are able to catch on that little and deliver more for the little that we have on our plate. But with that background, I just want to share a little bit about who AGA is, and then quickly go through what we have achieved since the last year's 5th Health Financing Conference. So I don't know whether it's clear. So AGA is registered. We have been here since 2003, and it was started by students, medical students of Mulago, and we know one of those was Dr. Nelson Musoma, who is the current Director General of Uganda AIDS Commission. He started AGA as a young man, but 20 years later, AGA still stands, and very many others. I'd also like to recognize, I know a number of our organizations have become extinct. I would also would like to recognize Health Rights Action Group. It has expired, but was the mother of AGA at the formation. They did the first proposal that made AGA what it is today. 21 years ago, AGA was born at Health Rights Action Group's HAG. If you remember, those of you who knew what HAG was, it was an advocacy organization that has been thrown out of service because of the different changing and shrinking space. So we are glad to host you, and we are glad to say we are among the very few lucky ones who are still lucky to exist despite the difficulties in accessing resources. Our vision is to have a just and inclusive healthcare system by promoting health and justice for all through community engagement, empowerment, social monitoring and accountability, evidence-based health financing, advocacy, and inclusive health service delivery. Our values, definitely, as a civil society, is about equity and justice. We want to be professional as much as we can. We would like to not discriminate against anyone. We would like to be as transparent as we can, and that's why we do our interventions and our work together with all of us, with government, with civil society, with party development partners. But finally, we realize that we are as good as we are well and as good as we are human. So we believe in wellness and humanness, and we premise our work in wellness and humanness and ensuring that we work together as teams and work with others from a courteous and a good relationship. Our strategy is to contribute to a strong and equitable health system that upholds human rights and delivers quality health care for all. And we have only 5 strategic objectives. We advocate for integration and implementation of the human rights-based approach in the Uganda health sector, which has now become a sub-program in the National Development Plan. We strive to strengthen platform for meaningful engagement in policy and programming, and this is one of the engagements. We promote social monitoring and accountability. We do a lot of community scorecards. We work together with community-led monitoring teams. And we do our irregular budget analysis, and we share with everyone who is part of this movement. We also would like to strengthen partnership and collaboration for the coordination movement on health financing. And we have tried over the years to ensure that we bring together health financing advocates. Although we have not reached where we want to be, but we have tried to continually bring together and have a consolidated health financing movement in Uganda. The final one is to make sure that we survive as an institution, but also deliver on our mandates. Before I stop, we would like to share with the teams here that over the last conference we had various proposals that we are going to do this kind of work, we are going to advocate, we have to have a roadmap, we are going to change things, to monitor, and so these are some of the things that we have done over the last year. And so even in this conference, we are expected to have a conference committee and also develop recommendations of our undertakings for the next year as a joint effort. So, over the last year, we have continued to lead the health financing advocacy teams. We have built capacities of civil society organizations. We have trained on budget tracking and monitoring. In these trainings, we have members of parliament, we have other members of the public sector. We have been to the local and urban governments. We have had various messages and petitions. We have met Minister of Health, we have been to Minister of Finance, we have met the committees on health, budget, HIV, others have been to the youth committees to bring issues of health financing to the fore. We have worked with government bodies. Some of us sit on the budget technical working group of Ministry of Health. We are part of the National Community Strategy, Health Strategy Implementation. We are part of the resourcing for resources and costing technical working group and system strengthening in various ministries, departments and agencies. So what I'm quoting here is briefly where AGA has been able to reach. We participate in annual donor country operation plans. We engage in PEPFAR programming. We engage with the Global Fund, and we are even representing there. Some of us on the World Bank Global community. We have been able to also participate in the EU, European Union, Belgian presidency, and the collaboration with African Union, which they are investing a lot in innovations for plants to produce medication in several countries. We are also part of the greater reproductive, maternal, neonatal, and child adolescent health and health aging platform. We are part of the Civil Society Budget Advocacy Group, which is an umbrella on budget advocacy, and we bring in our health space and try to make sure that we have consolidated budget advocacy. As a country, we are part of the primary health care think tank, and we are the steering committee. We have done a lot, and we are on many technical working groups, the non-communicable diseases. We have also been part of the general policy besides the budget. We have been also part of the general policy planning and programming for HIV, TB, malaria, the community health, the HIV investment case, the community health investment case, and various other departments' development of investment cases, but also health financing agendas. We engage as communities in developing national resource mobilization plans and applications, and we are part of the national joint ministries, departments, and agencies field visit and review missions. So we go to the field, we pick information, we bring it to processes of strategic direction. I think this is a repeat. We convened the annual National Health Financing Conference, and this year we have SEHA, we have SESBA, we have Ramika, we have AGA, we have PAS, we have Namama Africa, World Vision. Save the Children is a maiden member. We are glad to have you also supporting us. Uganda Care Straight Talk is also a maiden member. We have Voluntary Service Overseas, and we have PPDRO Africa region. So we are working together as a team. We have realized that once we get divided, we don't achieve anything. So among the other things we have done is to convene this, and for this year we are looking forward to ensuring that we feed into the upcoming East African Community Health Financing Dialogue. We had several engagements and what we participated in and what everyone is bringing on the table. We have implemented this health financing advocacy agenda together, and we are Namama Africa leading on the gender and feminist budgeting and advocacy lens. We have Civil Society Budget Advocacy Group, which is helping us to participate in the national and regional budgeting processes, but also building capacities of our members and partners as we are in the room around budget analysis, budget tracking and monitoring, and then for us we pick out the health bits. And we have had Uganda Cares who has led on prevention financing and HIV advocacy. We have had PPDRO, which has been helping us to popularize the National Health Insurance Scheme and has done research on the health financing landscape and using it to generate discussions and debates together with the different partners, be it Parliament, be it government, and within our own civil society, but also PPDRO is a regional entity. They will share with us later and engage us, and we have partners who are hosting the Ramika Health Aging Policy and Financing Advocacy, but we also know that they are also leading on the primary health care, particularly the arm of immunization. And we have had HELPS, which was working on health security and essential medicines financing advocacy. We have had World Vision, leading on social services and community health financing. We have had Living Goods, particularly taken forward even before the National Community Health Strategy came on board. We were looking at supporting and utilizing the community health workforce and activities, but also investing in the communities. And so what next do we expect from here is that we shall continue to participate in the ongoing national and subnational budget processes for financial year 2024 and 2025. We continue to build capacities of members. In the trainings we had in Kalangala, in Gulu, in Makinde, in the West Nile, we did realize that councillors actually don't have much information about how to track budget, how to inform budgets. They are called for one day to approve a budget of about 10 pages. They have not read, and then it is anyone anyone who is agreeable, your hands up, and then they do the hands up. So when we unpack the budget and we show them what is available, what they can do, they were really interested in having more information on how to budget track and monitor, but also to help us ensure efficiencies of the little money that comes to our local governments and also the urban governments. We are continuing to engage the ministry and the Uganda AIDS Commission as far as they are opening the health and HIV response sustainability roadmap, because we realize that there is breathing space in terms of financing, and we need to find means and ways and sustainable ways to ensure that we sustain the HIV and generate the health response in this country. We intend to participate in the East African Community Health Financing Dialogue, and we had a pre-meeting a week ago where we met the team from the headquarters. We were discussing how and the guidance and what we are looking forward to from this conference is that the recommendations we generate from here will inform that process. And we are also looking at having a roadmap for CS4-led health systems financing sustainability, and later on we'll be launching the AGA innovation on civil society-led health financing sustainability Premier 2030 Plus, because we have been looking at 2030 as the end of AIDS, but we don't know if we shall be able to do. So what can we do as communities beyond 2030 is the project we are launching today. We would like also to monitor government's allocation to community health systems. Whenever people are talking, whatever we have invested as communities, as households, is rarely recognized. And we would like to get it out of pocket expenditure, but be recognized as an investment by communities, and which needs to be recognized, but also lessened, because we are facilitating and complementing government's role to deliver on its health role. We will also would like to, from here, even hoping to develop a roadmap to fast track the retabling and scaling up on popularizing the National Health Insurance Scheme, because we think that is the ultimate. Whatever we are talking about on health financing, it's actually to build into having a national health insurance scheme that serves every one of us and also allows us to observe equity, but also have better health outcomes for all, and also improve all the indicators. We see a great and progressive change in our indicators, especially for maternal and child health. But we'd like to see, maybe we can go to even like only 10 mothers dying every 100,000, who would sing a song of joy and praise God, whoever our spiritual partners are. We will continue to develop petitions, develop policy briefs, and even maybe sometimes be on streets to demonstrate when we find things are not working. We shall continue to do litigation, and also continue to work with government and partners to ensure that we have national budget framework papers that are inclusive, equitable, and look to ensure that people are put first. And then we, of course, definitely continue to mobilize resources from among ourselves, from partners, to ensure that we are able to continuously drive the health financing agenda in this country. It's not that we have not had challenges. We have had challenges. I think I skipped during the presentation. But the challenge we have, and which we'd like to put here, is that we are having challenges staying in operation as civil society. There is a lot of reporting and accreditation for NGOs that is a deterrent to many of us. The resources have reduced because if you are not renewed a permit or you don't have a permit, you can't operate. So a number of people, to get a permit, it takes so long, and I've been asked to go to districts to get an MOU from the district. It takes forever. For instance, we started renewing our permit last year. It's only now they told us our permit is ready, but it's awaiting a signature for the last 3 months. From a signature from the ED. So we are wondering what is going on. Too many NGOs are being registered, or is it the staff at NGO Bureau are slow? But we also have other forms of accreditation. Uganda Youth Commission wants accreditation, FIA wants accreditation, URISP wants accreditation, you have FIP and the NITA, they want accreditation. Everywhere we are going, it is becoming, and that involves money. Each place you go, there is money. So our challenge is so big, and we are looking forward to asking the NGO Bureau and government and parliamentarians to save us, because we are complementing government work. How can we have a one-stop reporting place where we go, submit our things, and get accredited? And they do their monitoring along the way, so that we don't have to go to Kabale, Juba, wherever, because we think the government has a national system of tracking who is who and where. So that we don't have to even get the 1,000 that was meant for a family for food to go and pay all the districts. And it is open knowledge, it's open secret that we should be able to get an MOU from many of these districts. You have to pay them to sit, because they sit once in a quarter. So if you need to be on the agenda for the quarter, you must facilitate either an in-meeting, because the agenda or the list is so long, and it is very deterrent and also affecting us. I want to thank you very much all for coming and for all your support from government, from parliament, from the civil society organizations, and I look forward to a fruitful debate and discussions in these 1.5 days as we discuss community health financing systems and sustainability. I thank you.